Hello, my name is Robert Ervin. I'm a student here at the University of South Alabama College of Nursing. You can see it on my ID, and I will be performing a medication administration checkoff today. First, I will make sure that I am in a interruption-free zone. That means I will not be taking phone calls. I will have the door closed behind me, and I will not listen to any colleagues unless it is emergency or pertinent information. All right. I'd also like to note that I am in the proper College of Nursing South Alabama uniform. And here, let me do a scan of the room. All right. All right, let's get into it. So I have my patient care order form here into my MAR. I will be checking my patient's name, Jaguar J. Jones, medical record number 4176352, medical record number 4176352, and he is getting Novolin R regular insulin, so that is correct. I'll now begin my first check of accuracy, so I don't need that anymore. So I will check the patient's name, Jaguar J. Jones, his medical record number 4176352. I'll check to see if I own or have gotten the right drug. Novolin R regular insulin. That is Novolin R regular insulin. All right. And check again, Novolin R regular insulin accurate. All right. He will be getting 10 units of insulin, that's the right dose. Subcutaneously is the right route, which is what I have here. 30 minutes is the right time, and 30 minutes before his meal. He has a meal coming up in 30 minutes, so that is the right indication, which means all the elements of a legal prescription are present. And on that note, I will proceed. So I will start by unwrapping my needle. Actually, before I do that, alcohol swab the drug itself. Don't want him getting any infections on my watch. And now I will begin unwrapping my needle. Which I have here. Alright. Take the cap off. The sharps container. Alright, safety up. And check. This is the proper needle for a subcutaneous needle, which is proper for this procedure. Alright, then I will take back the safety. I've already swabbed my medication. I will draw out 10 units of air and inject the air in. And flip. I will draw out 15 and then push back to 10. All right. That is 10 units of Novolin R regular insulin. All right. And now I will begin my second check of accuracy. All right, so on this one, I have first off, Jaguar J. Jones, yes, medical record number 4176352, that's correct. The right drug I just pulled from this bottle of Novolin R regular insulin, that is what he is prescribed here. I pulled out 10 units, which is what is ordered here. 10 units of Novolin R insulin. This is a subcutaneous needle, which is what is needed for this procedure, subcutaneously 30 minutes before a meal, which is the right indication. And as I'm doing this, before I finish up my second check, I will tape off and label my drug. Good enough. All right. So on that note, on my label here, I will put down the patient's name, Jaguar J. Jones, the name of the drug and the amount. I'm left-handed. And the right amount, which is 10 units. Alright. So I will then label my syringe. Ooh, that's sketchy. Let's see here. Alright. And I have here labeled Jaguar J. Jones, regular insulin, 10 units on my label. Take that away from me. Alright, that completes my second check for accuracy. Almost forgot to mention that all the elements of a legal prescription are present, which completes my second check of accuracy. Alright, I will now move to the patient's bedside. Over here, and with me I will take my medication administration record, an alcohol swab, my syringe, and my medication. I'll also have goggles with me, and before I begin I will perform hand hygiene, and then I will don clean gloves. Alright. Alright, I'm in Mr. Jones' room. Hi, nice to meet you, Mr. Jones. My name is Robert Ervin. I'm a student here at the University of South Alabama College of Nursing. Today I'll be, heard you got a meal in 30 minutes, so I'll be giving you your insulin today, regular insulin. So let's check your name, Jaguar J. Jones, against your armband, Jaguar J. Jones, medical record number 4176352. Medical record number 4176352. I see you're allergic to penicillin, and this is room 2040. Room 2040, I'm in the right room. Good. All right. So now I will begin my third check of accuracy. That was probably part of it. Jaguar J. Jones, Jaguar J. Jones, medical record number 4176352. Medical record number 4176352. Got it. I have with me Novolin R, regular insulin, which is the right drug. Novolin R, regular insulin. That is the right drug. I have the right dosage here. I have a subcutaneous needle. Right dosage, Jaguar J. Jones, 10 units, which is what I have in here. 10 units. All right, and that is what is prescribed here. This is a subcutaneous needle. I will be giving this subcutaneously, so this is the right needle for this procedure. 30 minutes before a meal, which is the right time and right indication. It is 30 minutes before his next meal, so I am giving this on the right time. All right, all elements of a legal prescription are present, so I will proceed with the injection. All right, hello, Mr. Jones. I'm going to be giving this in the abdomen. Right, and on a subcutaneous injection, first I will swipe at the middle, going around the edge, and I'll leave this to point to my area. So on a subcutaneous injection, if you can pinch 2 inches of skin, you will give it 90-degree angle. 1 inch of skin, you will give it at a 45-degree angle. So on Mr. Jones here, I am able to pinch about 2 inches of skin, so I'll give it at a 90-degree angle here. aspirate. Right. And right into the sharps container. All right. Go ahead and swipe down and hold pressure. Ask Mr. Jones, how did that feel? Was that tolerable for you? Yeah, that was fine. All right. You are good to go, Mr. Jones. Have a good day. I will wrap up, take my stuff with me, and then go report to the nurse's station how Mr. Jones tolerated the procedure. And that